Hello, everyone, and welcome to Let's Align podcast. I'm Ruhi, and I'm so glad you're here. Whether you stumbled upon this space by chance or you have been following along, thank you so much for tuning in. I created this platform to have honest, meaningful conversations about life, growth, challenges, and everything in between. Now, imagine waking up each day with a mission, not because it's easy, but because it matters. Caring for someone you love becomes a journey that shapes you in ways nothing else can. And today we are diving into that journey, the challenges, the resilience, and the heart. And I have a very special guest today, Dr. Angela Downey. She's a family doctor, host of the Codependent Doctor podcast, and author of the book Enough as I Am. She helps people break free from people pleasing, perfectionism, and burnout to live more aligned, authentic lives. Angie, welcome to the show, and it's such an honor to have you with me today.
Hi, Rahi. I am so excited to be here with you today, and I hope that we can get through some of these caregiver challenges.
Absolutely. I am really looking forward to this conversation because I know your work has truly impacted so many lives. And honestly, I can't wait for our listeners to hear your insights and stories firsthand. So, thank you for being here. Can you take us back to the beginning of your caregiving journey as to what sparked it and what did you discover about yourself that you didn't knew before?
Yeah, so my caregiver journey began when I had my first child. So at the time I was an accountant and I got laid off from my job and I was pregnant. And so when I had my first baby, I was like all the moms out there who are a little bit lost and aren't sure how they're going to keep this little package alive. And in the meantime, I was also going through this struggle of wanting to follow some of the dreams that I had had. So I'd always wanted to be a doctor. And so when I got laid off, I struggled with trying to figure out, you know, what my role was going to be as a mother and wanting to pursue some of my dreams. So I did end up going back to school. I did want to get into medical school. So it became a real juggle trying to figure out how I was going to take care of a baby and be a mom and wanted to be there for my child and give them whatever they needed. So that was probably the beginning of my caregiver journey. And now that's 20 years later, I have two children, and I'm also living with a partner who has an 89-year-old mom who lives with us. So 89 years old, early dementia, and on oxygen, and has a lot of caregiver needs. So there's been this shift now where I'm now part of that sandwich generation that is trying to raise children and work and do everything else that moms are supposed to be, take care of myself, and take care of an older person who's also living in my home.
Thank you so much for sharing that. And it's so empowering to hear how your own journey started and what it revealed about you along the way. I know there are so many people out there who might be walking through something similar, and hearing your experience could be the reminder that that they are not alone. So thanks for that. And I know that caregiving can be incredibly meaningful, but it also comes with emotional and mental struggles that often go unnoticed. If I may ask you, what are some of those silent challenges that you think that caregivers face behind closed doors?
Sure. So for myself, there's a lot of guilt, guilt for having things that I'm wanting for myself and guilt of not being enough for my children and for anybody else that I'm caring for. Just that constant guilt, not being able to go, maybe I can't go to all the concerts that my kids have, or maybe they can't go to all the doctor's appointments. So there's this constant juggle between feeling guilty and being a caregiver that I would like to be. You're also carrying this huge mental load. So trying to remember, everybody's appointments, who needs a dental appointment, who needs medications at this time, who what should we purchase for Christmas or birthday gifts. So this big mental load of trying to sift through all these responsibilities that you have as a parent, it can really be overwhelming sometimes, and it's something that people don't often see. And sometimes when you're giving to other people all the time and you want a little bit of time for yourself, you might start resenting those people that you're taking care of. So that resentment can build up, and then you start feeling guilt and shame about, wanting things for yourself and not being able to give it to other people. So, adds up for a lot of people, and there are so many challenges that people don't even see. Even the invisibility. If you have a child, it's almost like you fall off the face of the earth, and everybody cares about your child, and everybody, cares about what's happening to the people in the world, in your world around you that you're taking care of. But oftentimes people don't check in with you and see how you're doing. So it's like you become this invisible person. So these are all things that happen behind closed doors that people don't often see, these struggles that you're facing, and sometimes you can feel really alone in that journey.
I totally agree. A lot of what caregivers go through isn't seen or talked about enough. And hearing you name those struggles out loud is really powerful. So I'm sure many people listening right now will feel understood. You often talk about people pleasing and perfectionism. I have been
Mhm.
following your podcast. So when it comes to caregiving, how do these patterns usually show up?
Yeah, so, I grew up being a people pleaser, not really being able to, like, respect what I needed and just trying to be what everybody else needed me to be. So as a people pleaser, you often start ignoring your own needs and just doing what everybody else needs you to be. And that can lead to all sorts of things like, burnout and resentment, because we all have needs. And so if you're not able to see what those are and you're not able to respect that have needs, you just end up giving to everybody else and you leave no energy left for yourself. So being a people pleaser has been really challenging, and I've really needed to learn to set boundaries. I also have struggled a lot with perfectionism throughout my life, and you know it all became about appearances and needing to look like this super mom who could hold it all together for her kids. And I wanted to be able to show people that I was able to go through medical school and be this doctor and be the perfect mom. And there's a lot of pressure with perfectionism and constantly trying hard to do everything right. So, if you get invited to like a bake sale or something, you don't buy cookies at the store, you want to make something fresh, even though you really don't have the time for it. So perfectionism can really, it's hard to maintain perfectionism. And so, if there's anything that I've learned over time is that there is no such thing as perfectionism, and you can't please everybody. I can't control what everybody wants. So I can't please everybody. So learning to manage my people pleasing tendencies and the perfectionism has probably been one of the biggest challenges I've had. It's worth investing the time to manage that. You also become, yeah, you can get burned out as well through overgiving, which is something that I've also had. So trying to do and being the one who's like the strong one and able to do everything. So that's also been a big challenge for me.
Well, I think that makes a lot of sense. And I feel that it's so easy to fall into those patterns, especially when you're trying to give your best to someone else. I think the way you explained, the science will really help people recognize it in themselves. Caregivers play such a vital role in families and communities, but I think their work often gets or goes unnoticed or undervalued. What do you think about it?
So society has this like romantic idea that, women, should be sacrificing and should, be able to support everybody. And, we're kind of raised with this idea that women and daughters should be selfless and should be caring of other people. But it really there's this expectation that we should do it, but society doesn't always support that, right? There's this expectation that women should be like there very much is a gendered component to caregiving, and caregiving often ends up on women's shoulders and daughters' shoulders and whatnot. So there's this romantic idea of what self-sacrifice should be, but it's not often supported. So there's still this expectation that women are going to be able to manage everything else in the household, manage children and expectations. So it often gets overlooked what women need to be healthy and to be well. And there's very little help out there. Caregiving work can be, invisible. It's unpaid. It gets taken for granted a lot of the time, and caregivers are often invisible. So it's yeah, there's all sorts of complexities in there, and we don't often society doesn't give space for all those complexities. And it becomes really important for us to, to shift some of those narratives and to name them. So we need to be sharing our stories and talking about some of our challenges and normalizing that it's okay to accept help and it should be normal to ask for help and that's okay.
You're so right. I strongly feel that we should actually speak about the challenges. I know caregiving is, you know, very good feeling when someone is taking care. But at the same time, as you called out, it definitely gets unnoticed, even though it's such an important work. So thank you so much. You spoke with that honesty and clarity, and hopefully it helps more people see it differently.
And Ruhi, I want to thank you actually too, because having this podcast and talking about this is a really great way to get this message out there for our caregivers who might be feeling really tired or exhausted or neglected. So thank you for having the podcast and for talking about all the challenging
I'm so honored to
roles
have
for
you. And
caregivers.
yeah, I'm so honored to have you. And I think we definitely need to have these conversations because many a times who may not be the caregivers, they may not understand the dynamics. They may not understand what does it take to be a caregiver and what's the toll it takes on an individual. So definitely, uh, I'm very happy that we are having this conversation today. And the way you called out that we definitely need to change the narrative around it, and that happens only when we do the real talk in terms of challenges, in terms of the burnout that happens during that process. So yeah, thanks for shedding light on that. Now, if someone listening right now is deep in caregiving role, maybe feeling frustrated or rather unseen, what's one reminder you would want them to know?
Just one?
Okay, go ahead.
I've got lots of things. So one is just recognizing that you're doing a really hard thing here. So, give yourself some grace, cut yourself some slack. No one is trained knowing how to be a caregiver. We're just figuring this out one day at a time. So just recognizing that you're doing something that's really hard and to, be compassionate with yourself and be kind to yourself as you're, learning how to navigate all this. And second thing would probably be that you're allowed to need things, and needing things and having needs for yourself doesn't make you any less kind or any less good at being a caregiver. And it's okay to ask for the things that you need. And, my other piece of advice is that caregiver burnout is a real thing and it can be really, really tough. And Ruhi, do we have time for me to share a quick story?
Absolutely, go ahead.
Sure. So I'm a family physician, and at one point, I was practicing medicine and I ended up getting sick. But like most women do, we push through our illnesses and we still end up taking care of everybody else. But what happened in my case was I was sick for a little while, and I continued to work and push through. And what happened was I was burning out, and I don't think I recognized the signs, the resentment and the irritability, and I started to really resent the people that I was trying to help. Because when it came down to it, my cup was completely empty and I had nothing left to give, but I tried so hard because I didn't want to disappoint other people. And I felt guilty for not being there for them. So I pushed through as we often do. And what happened was I started resenting people for needing things from me when I had nothing left to give. And so I started blaming people for not getting what I needed. So this looked like being irritable, and I started being really mean to people. I told some patients some not so nice things that I am really not proud of. And it all came from me not being able to ask for what I needed and not recognizing that I was burnt out. So from that, I learned that if your cup is empty, you can't do anything for anybody else. So it's really important to take care of yourself and make sure your cup is full and not to push through the things that you need, because if you've got nothing left to give, you're probably going to end up hurting other people in the process anyway. So you're no good to them. Pushing through and doing what you need to do is not helpful, and it, potentially could end up hurting other people. So really important for you to recognize if you're burning out and to ask for help and to figure out what you need to do to keep your cup full, whether that means asking relatives for help or hiring help. In medical school, I had to hire a caregiver. I kept saying that I hired a mother, someone to take care of me and cook my meals and do my laundry because that's what I needed at the time. So it's important to recognize that you have limits and it's okay to ask for help.
I think that's a very valid point where you call out that you too have limits and it's absolutely okay to ask for help. Many a times, caregivers end up not asking for help because of the
Mhm.
guilt that probably the person for whom they are providing the caregiving, they may feel that we are overburdened. But as you called out, it's really important that we are in good space for us to provide that support, that love and warmth to the people around. So thanks for sharing that. And I think
Mhm.
sometimes we just need that one simple reminder to keep going, especially when things feel heavy. I know that message will really stay with our listeners, and I'm so glad that we are talking about it. How do you personally navigate holding both grief and gratitude, especially when you're watching someone you love struggle?
Yeah, so right now I am living with the mother-in-law here and she's got early dementia and she's really struggling with her loss of independence. And I think the big struggle that we have is I want to be of help and I want to be of assistance, but it's really difficult because this other person is mourning their loss of independence. So we're walking this really narrow tightrope rope where, I'm grateful to be able to be of service and grateful that I'm able to help, but on her end, she's, grieving that she can't go up and down the stairs to do laundry anymore, and she's really hard on herself, and it's hard to see somebody struggle and to watch them slip away. Although I'm grateful that I'm able to do these things with her and for her, and I love the time that we get to spend together. It's a really narrow line of trying to be supportive and yet understanding that this person is struggling. It's the same when your kids are struggling. I have 2 adult children. They're learning to navigate the world on their own, and I'm grateful all for all the moments that we have together. But then there's this grief of having to let go and, watching them find their way. So it's this very narrow tightrope that we walk in life, and it's important to recognize that we're grateful for certain things, but we are going to grieve some things that we've lost. We're going to grieve some things that are changing and are different.
Yeah, that's so true. It's something that so many people go through, but don't always know how to talk about, like feeling both the pain and at the same time gratitude. And the way you explained it makes it feel a bit easier to understand. And I think it will really help people who are trying to hold both. So I truly appreciate your honesty on that.
Yeah, it's important to know that like both things can be true at the same time, right? So you're allowed to be happy with this person and you're also allowed to be really frustrated with the person. So both things can be true at the same time, and sometimes people feel like they need to pick one or the other or they feel guilty for being upset. But both things can be true at the same time. So it's difficult to navigate sometimes.
Yeah, that's so true. Now I have one question that I have been thinking ever since we started this discussion is many a times there is this guilt factor that comes in, that creeps in during the caregiving journey. How do we navigate? How do we understand that it's not the guilt? How do we actually address that feeling?
So I think that guilt comes from thinking that we're disappointing someone or that we're not good enough. And sometimes we also think that, we mix up guilt and shame. So, guilt is I've done something bad, whereas shame is I am a bad person. So guilt tends to be temporary, it's something that we can learn from, whereas shame is, we internalize those feelings and we think I'm a bad person. So it's really important that if you're feeling guilty for something that you try and figure out, like, is this truly guilt or is this shame? Are you feeling bad for who you are because of whatever the situation is? And it's okay to feel guilty and it's okay to do things even though you feel guilty. So it's really important to step back and think about, okay, so you're feeling bad about this one event. And what is it about this event that I feel bad about? Am I feeling bad because I'm not showing up for them? And then to think like, is somebody else showing up for that person, right? Do I need to carry all this weight by myself? But if the problem is, I feel like I'm such a bad person because I couldn't be there for my mom, where does that come from? Like you're not a bad person. And so it depends I don't know, I feel like I'm talking in circles here. It depends why you're feeling guilty. And so to think about like, is this reasonable for me to feel guilty about this? And is it guilt? Is it shame? And because if it's shame, then you need to deal with like why you're feeling like you're a bad person when deep down you probably know you're not a bad person. And if it's guilt, maybe you need to do the thing anyway. If you need to not help your friend move this weekend because you've had a really rough week and you feel guilty for saying no. Why do you feel guilty? And maybe you need to take that time to rest. So maybe you can rest anyway. You can say I can't help you move and you can rest anyway despite feeling that guilt. Yeah. Guilt is tricky and shame is tricky, and it's amazing how much we carry and we put on ourselves.
Yeah, I think it has got a lot to do to understand, firstly, or rather differentiate between guilt and shame and strike that balance as you called out. Caregiving can actually stretch you in ways you never expect. If I may ask, what have been some of the most surprising lessons that you have discovered even in the hardest moments?
Yeah, so one of the toughest things that I've learned is that I have limits and I need to recognize when I'm getting close to those limits and when I can't do something anymore and being able to recognize that that limit is coming up and figuring out what am I going to do about this. So, in the past just pushing and pushing and pushing and just, I can do this. I can do this. I just need to work harder. So, and of course that leads to all sorts of horrible things like resentment and burnout and so just learning that I have a limit and figuring out, okay, so what am I going to do about this now? How am I going to fix this? So that's probably one of the biggest gifts that came through my period of burnout was just learning to recognize that I have limits and trying to figure out what I'm going to do with them. Another one was letting go of perfectionism. So I used to be trapped in perfectionism. Almost couldn't do anything because I, worked so hard for things to be perfect. So as an example, I started a podcast a year and a half ago. And that first episode, I think I recorded it like 5 or 6 times. And finally, I just said, you know what? It's never going to be perfect. And that's okay. And trying to find that perfect episode was really holding me back from starting this podcast, which was one of my dreams. So figuring out like what is the minimum I need to do to put out a good product. And I published my first episode. And once I did it once, and then the next episode was a little bit easier and it got easier. So if I wouldn't have been able to let go of that perfectionism, I don't think I ever would have started that podcast. I think I would have just recorded the same episode over and over and over again and not actually put out a product. Um, yeah, that's letting go of perfectionism was a big one for me. And also recognizing that I don't have to please everybody because that can really hold you back too. You can't control how other people are going to react to you. So, trying to please everybody just takes up a lot of energy and you're never going to be able to please everybody.
I have been following your podcast, and one of the episodes you did talk about people pleasing as a caregiver. Do you want to share a bit more about it? Like when a caregiver is in this journey, many a times unknowingly they get into this people pleasing mode. How can one recognize that they are heading towards it, and what can they do about it?
Yeah, so one of the things that it's actually coming up on an episode pretty soon. What's really helped me to figure out like, am I just people pleasing or is this something I want? So the next couple weeks, I've got an episode coming out on like the authenticity pause, and what this is just taking a minute or 3 seconds to just check in with your body and see how you're feeling. So if somebody asks you to do something, you just take 3 seconds and your body knows when something's up. So you might get like a sick feeling in your stomach, or you might get some chest pain or some tightness. So if there's something that you're excited to do, your body's going to feel energized and you can say, yes, I want to do that. But if somebody asks you to do something and you feel sick to your stomach, you need to pay attention to that. So just by taking that quick pause, that 3 seconds when somebody asks you to do something, it doesn't matter if you're staring at them blankly or what, but just taking that 3 seconds to check in with your body and see Like, how am I feeling right now? And if you're not feeling very good, you need to listen to that and you need to kind of ask yourself, is this really what I want? Is this something that I need? Do I have the time and do I have the energy to do this? So that pause really just gives you time to check in with yourself and to evaluate if this is something you really want to do. And if you don't, then you need to not, figure out a way to not do it and to honor how you're feeling. And but a lot of people, with time and the way that we were raised, often we've learned to ignore these feelings. So, somebody, something that's coming to my mind right now is, if an uncle comes to give you a hug at Christmas time and you don't want to do it, you feel sick in your stomach, but you do it anyway because you know that this is an expectation that's there. So every time you override your natural instincts, you're teaching yourself how to please others. So you learn to do things just to please other people. So even though you're feeling sick and you know you don't want to be doing this, you do it anyway. And that's something that we've learned over time is how to override our natural instincts to say no to things. So this pause is just a way for you to get back to paying attention to your body and paying attention to what you really need and to honor what you need from other people. People pleasing can be really, really, really tricky. And that's kind of something that I'm starting to teach others is how to pay attention to their bodies and learning to respect what their needs are.
I think you have definitely shed some light on how subtly we can set the boundaries and totally go with our intuition if something doesn't feel right. Like the classic example that you gave about an uncle trying to, hug you on a Christmas Eve. And if you're not comfortable, many a times we just ignore that fact. But I think, as you called out, it's really important we listen to our intuition. And if something doesn't feel right, maybe it's absolutely fine to take a step back. In your own journey, have you found that caregiving can go beyond support and actually become a space for healing, I would say, old wounds, or let's say breaking generational patterns?
So caregiving can be very rewarding, and being able to share your life with somebody who's in a very vulnerable situation it can be very special and it can be very rewarding. There's the flip side; it can sometimes be very frustrating. But I personally get a lot of joy and reward from being able to help other people. It also gives me a lot of time to spend with somebody who's got way more life experience than I do, and there's always these, like, beautiful gems that come from having these relationships with people who have more experience in life than you do. My children have taught me, so much about myself as well. So even though you have these ups and downs and, periods of uncertainty, there's a lot of good that comes from being a caregiver, and you get to know a lot about yourself. But it's important to stay true to who you are and to make sure that you're getting what you need. Otherwise, you're not going to be able to see all those good moments. You're going to be so burnt out and unhappy and irritable that you're going to miss out on all those good moments. So it's really important to find a good balance where you are taking care of yourself, and that's going to be able to allow you to see those good moments. So by taking good care of yourself and maybe not doing everything, having other people support you and do other things, it's actually going to, like, allow you to grow and learn more and enjoy that other, the person that you're caring for.
Well, that's a really powerful perspective that you shared. And it's so amazing how caregiving can open up space for healing in ways that we don't even expect.
Hmm.
Now, let's look at another aspect. Looking back, what do you hope the next generation understands about caregiving?
I would love to see, you know, that not one person has to take on the role by themselves, and that I come back again to there's expectation, or I guess this yeah, I guess an expectation that girls are going to take care of their parents when they're older and when they're sick, but guys do just as good a job too. And society needs to have a shift. Women tend to be seen as, like, warmer and more caregiving, but guys can do the same thing. They can bring people to appointments. So In the future, I'd really, really like to see everybody pitching in to care for somebody, because right now everything seems to fall on one person. One person seems to take more responsibility than everybody else, but that person burns out very quickly, so nobody really wants that role because it's a lot of work. But if everybody pitches in, then it just gets a little bit easier. So it takes us like we need a bigger community to be able to help people. So for future generations, it would be wonderful if more people stepped up. You definitely see a lot more men now stepping up when it comes to, child rearing. And with time, there's more and more expectations that guys are going to change diapers. Like 50 years ago, you never would have seen that. But now times are changing, and it's because we're having these conversations and people have more expectations of others to step up and do things. So as generations change, it's important that we have these conversations. Otherwise, nothing is going to change.
Well, I think that makes a lot of sense. And a lot of us don't get taught these things. As you call it, that many a times it's the women who takes up that role of caregiver, and we just try to figure them out along the way. I think what you shared will definitely speak to people, and in the coming generation the community should come together in terms of caregiving and not just have that role confined to women.
Absolutely.
Angela, you also host a podcast which I have been following. For someone tuning in your podcast for the first time, what's one good episode to start with, especially for the caregiving or people who are going through a similar journey?
There are there are many good podcast episodes in there. So I like the people pleasing episode, mainly because I'm a big people pleaser. And, I've got, it's something I've definitely struggled with. There's a good episode on shame, as well, and what shame is. There's lots of good episodes, a lot of stuff in there for like mental wellness, mental health, learning to set boundaries. It's a topic that I'm really passionate about. It's impacted my life in so many ways. So, whatever I can put out there for people to benefit from, that's my goal, is to, if you're not able to afford therapy or whatnot, there's a lot of, there's my podcast, there's a lot of good podcasts. And I've also got a book called Enough as I Am that addresses all of these issues. It's a workbook that'll help you work through some of the conditioning that you've taken on as a child, and now, whatever you're taught as a child is no longer serving you, and you're struggling. So there's lots of things in there on perfectionism and people pleasing, feeling chronic guilt.
Well, I have heard quite a few episodes of your podcast, and I must say that there's something so comforting
Mhm.
about hearing real, honest conversations
Yeah.
from someone who has actually been there. So, firstly, thank you for having that podcast, because I'm pretty sure many people like me would definitely listen to it and learn a lot. So, I'm really looking forward to the other episodes that I have just halted it for some time, and I'll go ahead and listen to the remaining episodes. Tell me a bit about what were you thinking when you thought that, let me get started with the podcast. What was the reasoning behind it?
Yeah, so I talked a little bit about going through a period of burnout. So I was a family doctor, and I went through a period of burnout. I ended up walking away from my family practice because I couldn't manage anymore. I was, sick and having to do IV treatments, and my heart wasn't doing well. So I had to leave it all, which was unfortunate, because I think if I would have learned to manage my codependency before that, I feel like it's something I could have navigated by setting boundaries and whatnot. So it was what it was. So I left my family practice and I started doing a bunch of therapy and whatnot. I didn't really know what codependency was at the time. And by looking into it, then I realized that I did have a lot of codependent tendencies that I had acquired as a child. So my self-worth was, based on what other people would do. I needed a lot of validation from other people to feel good about myself. I needed to, please other people and be the good girl and do everything to help other people. That, became one of the biggest challenges that I worked on through therapy. And this is a really great way for me to continue doing therapy. So I'm basically doing it all myself by putting out these episodes. And, every day I'm reading lots of self-help books and whatnot. And being a physician, I do like to support patients and other people through their journey. So And a lot of people can't afford therapy. So I thought, I'm just going to put myself out there. I'm going to share my story. And if there's one person out there who can benefit from hearing, my struggles and how I overcame them and how you can start learning to set boundaries, then I figured this is a really great teaching opportunity and a way for me to support other people who are going through the same thing without making them feel bad about themselves. So this podcast was a really great way to reach people who needed more help.
Thanks for sharing that. I'm definitely loving the episodes that I have heard so far. And I'm pretty sure our audience who will be listening to your episodes, they would definitely connect with what you have discussed during this conversation. And now, before we wrap up, if you could speak directly to every caregiver listening right now, what's one heartfelt truth you would want them to hold on to, especially on the days they feel forgotten?
Just be kind to yourself. So, giving yourself some self compassion. You're doing a really hard thing. You're doing a really good thing for someone. So just be kind to yourself and don't feel like you need to do it alone. Feel free to reach out to somebody if you need help.
Thank you so much. That was so real, so honest. Many a times we end up being kind to everyone except us. And it's a very good reminder that it's equally important to be kind to ourselves while we provide that support and love and kindness to everyone else out there. So thanks so much for that.
Thank
And
you.
that wraps up today's conversation. Thank you so much for opening up and sharing your story with us. I can definitely say that you reminded us that caregiving isn't just about helping someone, it's about strength, it's about love, and showing up in the most human way possible. So, Angie, I thoroughly enjoyed this conversation today, and every aspect that you shared that really resonates. I'm sure that resonates with our audience. And thanks for being here.
Thanks, Rahi. I really appreciate your efforts and thank you for putting out this podcast.
I would definitely want to have you one more time on my podcast. So
Amazing.
I would stay connected. And
Perfect.
to all the caregivers out there, please remember that you're seen, you're appreciated. And as Angie said, please know that you truly matter. And if this conversation spoke to you, please pass it on to someone who might definitely want to hear it today. And as always, take care of yourself with same compassion you give to others. I'll see you all in the next episode. Until then, take care and goodbye for now. Bye, Angie.
Thank you. Bye-bye.